Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn the podcast over to the students from the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis. We give credit to Professors Stephanie Lucas and Terry Wahalik for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacies, Mercy, or the University of Health Sciences and Pharmacy in St. Louis. Today, we welcome 4 students from the pharmacy school with a podcast entitled Pharmacy Voices, Elevating the Profession and Patient Care.
Hello, and welcome to our podcast episode called Pharmacy Voices, Elevating the Profession and Patient Care, where we will talk about advocacy. My name is Abba Motu. I'm from Plainfield, Illinois. I'm a P2 at the St. Louis College of Pharmacy, and some of my hobbies include drawing, being outdoors, and binge watching Netflix shows. In the future, I hope to be in the research and development of pharmaceutical cosmetics.
Hello, my name is Adira Sambatkumar. I am from St. Louis, Missouri. I'm a P2 student at the University of Health Science and Pharmacy. My hobbies are playing tennis, dancing, and listening to music. I hope in the future to become a medical liaison at a pharmacy company. So first, we are going to start with what advocacy really means. Advocacy is the act of promoting a cause, policy, or interest to bring about change and awareness by acting on behalf of individuals.
So you're probably wondering why you should care about advocacy as a high school student. Well, we believe you should care about advocacy because pharmacy as a profession needs stronger voices to advocate the policies that shape healthcare. And also, as you all will be able to vote soon, you will have the power to support candidates that promote affordable, safe, and accessible healthcare. Being informed about current issues like drug pricing, pharmacist roles, and healthcare equity helps you to make educated voting decisions that influence the well-being of you, your families, and your peers. Today, we have the opportunity to talk to Dr. Garth Reynolds, who is the Executive Director of IPHA, or Illinois Pharmacists Association, to give us some more insight and information about advocacy and IPHA as a whole. I guess my first question for you would be, what is advocacy to you personally, and what are ways that your organization advocates?
Well, one, I would say advocacy is our individual and collective way of lifting our voice up for a certain cause or issue. And IPHA, as Illinois Pharmacists Association, is a way of lifting up that voice. We do it through multiple different fashions. And actually, I was just discussing this prior to the call. That's actually why IPHA was founded. Back in 1880, it was pharmacists from around the state of Illinois who did not like how the profession was being perceived by the public and by individuals who were selling fake medications to the public and were not pharmacists. And so they came together to actually create the first Pharmacy Practice Act in 1880 as the Illinois Pharmaceutical Association. And, and 144 years later, we're still working on that same mission, advocating for the rights of pharmacists and technicians and students to be able to best take care of their patients. And to also, in that same vein, be a voice for our patients, because a lot of times we talk about patient advocacy for our patients. We think of it a lot of times as in their treatment and working with other healthcare providers. But it's also talking to the General Assembly and other lawmakers for whether it's diabetes access to care or immunization expansion of access. We can help be a voice for our patients as well. So there's multitude of levels of how we help do that. And that's where it coalesces in our vision statement that IPHA is the voice for pharmacy in Illinois. We represent all different aspects of every practice site, every practice setting in the state. Now, that doesn't mean there aren't other pharmacy organizations, but we're the only one that represents all aspects of pharmacy.
Thank you.
Mm-hmm.
My next question is, what advice would you give to pharmacists or students who want to get involved in advocacy?
Take the one step forward. I know a lot of times when it comes to standing up for ourselves, whether it's our profession or our patients or even ourselves, it can be very challenging. And I would say in today's political environment, double E, triple E, 100 times so. And because we're in such a politically charged environment, a lot of times people feel cautioned, and probably more than ever before, about saying their opinion on an issue because they're afraid of backlash. And one thing is, I always talk with not only students but also pharmacists and even legislators at times. Pharmacy is not a red state issue. It's not a blue state issue. It's purple. As our chairman of our political action committee states, he goes, it's pro mortem pestle, because we have friends that are legislators for pharmacy that are on the most progressive side of the aisle to the most right MAGA side of the aisle. And we have to work with all of them in that continuum. And that puts us into a political position sometimes. I won't lie to that. But whenever it comes down to an individual wanting to start to advocate for themselves and for their profession, it's really going up to your senator or your representative on a state level, and then you can work to the federal if that's more comfortable. And just putting out your hand and saying, hello, my name's Garth Reynolds. I'm a pharmacist in your district, and I'd like to talk to you about issues that are impacting your constituents that we serve and how we can work together to help improve that. Really, and the reason I say that is because you are building a relationship with those legislators. And it's because if we think about it, in Congress, we are very fortunate right now in this time that we have 2 pharmacists in Congress. And before that, it was almost the 60s last time we had a pharmacist. And the last time we had a pharmacist of that marketed level, it was Hubert Humphrey, who was vice president to Lyndon Baines Johnson. That's the highest serving pharmacist we've had in the federal government to date. But in a lot of state level legislatures, like Illinois, we don't have pharmacists in the legislature right now. I know Missouri does. Missouri's got a couple in their general assembly or have in the recent past, and it's great. But in our general assembly in Illinois, we have an emergency room physician, and we also have a retired optometrist. And we have some, medical social workers or clinical social workers, but that's really the limit of what we have in healthcare experience. So the reason I state all that is because you can help be that expert for your legislator. And I know a lot of times you're like, well, I'm not an expert. Yes, you are. You're a healthcare provider. You know what's going on with your patients in your district, and you are the expert for your area. And that's where you can kind of help. And this kind of leads into probably what might be the next step is, well, how do we start explaining our issues? Our issues are very complex. And the way I always put it, and the way I've done this now for probably the last 4 or 5 years, especially after COVID, is I say, look at the interactions that you have with legislators as patient counseling. So what year pharmacy school are both of you?
We're both P2s.
Okay. So, in some respects, you're still learning some of the skills of patient counseling and understanding complex disease states. So look at that the same way that as you would sit down with a legislator. If they were your patient and they were just diagnosed with diabetes, do you explain all the continuum of diabetes and their medication and the patient understands everything in one session? No.
No.
No, it's impossible. And the same thing with the legislators. We have a short amount of time, so a lot of times we just regurgitate data. Well, we have sometimes short amount of time with patients too, and sometimes we regurgitate data. But that doesn't always get us to optimal outcomes. And that's where we have to make sure we have those conversations and multiple conversations. And over time, your legislator can be a true champion for the profession and be a better advocate for you as you're being an advocate for your constituents. They can be he or she can be a advocate for you on the General Assembly floor or with the governor's office, or if it's federal, even with congressional leaders and the president.
Thank you for that answer. I think you made some really great points. And I agree that like taking the first step is really the most important part, because I mean, everybody has to go to a pharmacy at some point in their life. So it really is like an everybody issue.
Yes. And that's where it's like our issues are, widespread throughout all of pharmacy. Things that impact health system pharmacists impact community pharmacists. Same thing with mail order pharmacists impact nuclear pharmacists. So it's just like we are all pharmacists at the end of the day, and we all can kind of help support each other in our different practice sites.
Mm-hmm. And next question would be, what are some of the biggest advocacy issues that you see facing pharmacy in the future?
Well, in the future is one that we're still dealing with right now. And right now that's payment reform. Whether we're talking about pharmacy benefit manager reform, it comes down to pharmacy has to finally get paid. And it hasn't been for a long, long time. And we've been advocating for it for decades. Even when I was a student, payment reform was a major issue, and it is one that has slowly eroded a lot of some of the stronger foundations we have in the profession. Now, I don't mean that the foundation's gone, but there are severe cracks, and part of it is crumbling severely right now. And we have to recognize that. But pharmacy always evolves, always figures out how to change. But we've pivoted a lot over the last 2 or 3 decades in trying to not get direct on this question and say, if a medication costs X number of dollars, you have to pay us X number of dollars plus a cost of dispensing fee so we can pay for our people that we have to help us deliver care for the time that we have with patients. And if not, we've got to come up with a completely new model, because what we're doing right now is insanity. Because right now what we're doing is we're saying, if a medication costs $20 for a pharmacy to purchase, and you're reimbursing from either a commercial program, a Medicare program, or a Medicaid program, and you're reimbursing that medication at $5, and then you're giving them 35 cents instead of what it should be a $15 dispensing fee, that transaction quickly multiplies and exponentially has a major impact on the sustainability of that practice. And I know a lot of times when we first start talking about these issues, we always say, well, we got to focus on the patient. I don't know how more we can focus on the patient, saying if pharmacy is not there, there's no access. And we've seen that. We've had now now a decade. It'll be a decade next month, where we had the very first articles come out from research from University of Illinois at Chicago on pharmacy deserts. And we really have focused on that. It's nice to see how advocacy works, because we now have legislators on the floor of the General Assembly using that term, where they didn't know what that term was, 4 and 5 years ago. But that's what advocacy helps with. Now, PBM and payment reform has to happen for the rest of what we need to do for our profession. We're training you to be stronger providers. And we've actually started to chip away at that, because COVID showed the value of a pharmacist to our country. And they're starting to recognize that, because in many states like Illinois, pharmacists are now able to independently prescribe and assess a patient on certain health conditions. And we're going to grow that, just like we've been wanting to. And what's been amazing is we've been working on that since I was a student. I remember that being told that being at St. Louis College of Pharmacy myself, and hearing, we're training you to be direct patient care providers. And I was like, well, I hope to see that day. Now the day's here. And now it's our responsibility from an advocacy point of view to help shape that and help continue to grow that, because now we finally have gotten the environment ready for what we have trained you for a number of years. And then it's going to be handing that baton over to you to say to keep kicking the doors in and keep pushing further, because it's going to take a long time before we have that full recognized provider level where pharmacists are really truly working at the top of our knowledge, skills, and training. And that's why, I think a lot of times, especially from a student point of view, you're like, why are we learning this? I don't see this being done in school. Well, we're training you for the future. And that's what we're training for you to do right now. I mean, it's just, and we're really where policy wise where I didn't think we would be for another 10 years. So we're actually ahead of the game, even though we really should have been here 25 years ago. But now we're here in our most recent strategic outlook. We didn't think we would be here until the 2030s. And now we're here in 2023, starting in 2022, 23, and 24, making those strides in not just Illinois, but in almost every major state. We're making those strides. And we've got to continue to keep pushing to keep pharmacies open, to keep access to pharmacies available, and opening more availability to us. Because, in a lot of rural areas of this country, we are the healthcare provider in those communities. I can think of a number of counties in Illinois and probably even Missouri where the local pharmacy and that pharmacist behind the counter is the only healthcare provider on a number of days, evenings, and weekends. And if we can open up that access to what we can be as a true connector to care, we'll have better access to keep people not having to wait and suffer when they have these healthcare conditions that come up in their lives.
Yep. I'm glad that payment reform is the next major issue that pharmacy is going to be looking at, because even now with we see pharmacies closing around the country. And I got to see firsthand at my rotation. I did my rotation at a small independent pharmacy, just how much it can affect them because they're not able to shelf medications that patients need because they're losing money.
Right. Is something we had a very fortunate situation where members of our organization, including myself, were able to have a couple of moments in a town hall with FTC chair Lena Khan. And of course, as you may or may not be aware, the FTC is investigating the actions of PBMs right now. And one of the aspects I used to close our comments was, I never thought I'd see a situation where right now, and kind of what you've discussed, pharmacists are now looking at patients' prescriptions as, can I afford this medication? Can I even afford to bring this in for my patient? Let alone, am I able to still make payroll next week if I fill it? And we're having those conversations before we should be asking questions, how best do I treat this patient? That's where we are now, where we're having to now bend the oath that we took because we don't have the infrastructure to sustain our oath.
Hello, my name is Adira. We are glad that you're here with us today.
Absolutely.
I have two questions for you. One of them is, how do you see the future in pharmacy advocacy evolving with advancements in technology and telehealth?
Well, one, I think COVID really showed the aspects of what we can do in telehealth in addition to what we were able to do in pharmacy. And I really don't want to discount the admirable stepping up our profession did during COVID. And I don't think it gets called out enough. When other providers were closing their doors, pharmacies kept their stores open. I never had a single pharmacy asking how to close. I had pharmacies begging us for information. How do we stay open? How do we keep safe? How do I keep my patients safe? And with that, 70%, and in some reports you'll even say up to 75% of all COVID vaccines in this country were given by pharmacists and pharmacy students and technicians. We saved this country and got it back on its feet. And with that, we also worked in a lot of different ways of trying to keep things moving, because in addition to the pandemic and treating the pandemic, we had to take care of everything else that we had to take care of the day before the pandemic. So everyone's chronic diseases did not stop because we had COVID. So we had to get very inventive with how we continue to process prescriptions, and we continue to address issues that our patients needed and getting their medications to them and answering their questions. So a lot of that had to do with technology. So we use a lot of technology. Pharmacy's always been on top of evolving and thinking outside the box and pivoting pretty quickly when it comes to these things. But, we've got a lot of new technologies that are coming forward pretty quickly, but I think can be great assets to us. I mean, and I'm really focusing on AI. And one of the things that we've been looking at from a policy point of view through IPHA and through some of the national organizations is, how do we develop laws and regulations around AI and the use of healthcare? And one of the ways that we want to make sure is that AI is as smart as the information that's put into it. So no AI is perfect. And so we should not be utilizing AIs to make primary healthcare decisions. That should still be left to the healthcare providers who are trained in evaluating, just like we evaluate literature data, we're going to have to evaluate AI data as well. But with that, I think AI is going to make us as pharmacists even better than we are today. Because think of it this way, if you have an AI engine that's helping you in the DUR assessment of a patient, right now, that's based on general population data screening against general, statistical norms. Well, what if you could take an AI engine that could actually look at that patient's genetic profile, put it against the current profile, and also add in the New England Journal of Medicine article that was just published this morning? That wouldn't be evaluated and put into any interaction profile for almost a year or two today. And so AI is going to help us be better pharmacists, where we're going to be able to deliver recommendations that are more for that particular patient, where we're still making very general statements and trying to look at what possibly this patient would be considered to a similar group, where we could be looking at data tomorrow that's going to help us. And that's where we got to make sure laws and regulations are in place and advocate for those ideas and protections of data, because that's going to be a thing. We've already seen where healthcare data, the protection of that's starting to get a little weak again because technology is advancing. Well, policy's got to get ahead of that to be able to protect it, because we don't want things what government sometimes can do, and that's put a cage around it. And then we have tools that could be very helpful for delivering and advancing pharmacy, and we're not able to do it. And so we have to continue to advocate, saying, yes, we recognize there's a problem, but let's come to a more common sense solution instead of a more restrictive solution.
Yes, I think that's a good point, like coming into like common solution, because with better advancement of the technology, it could go like wrong as well. So it's really important for like finding like common problems and common solution for it. And my next question is like, how can pharmacy professionals continue to advocate for policies which supports mental health, given the stress and anxiety caused by pandemic?
Well, excuse me. That's a great question. And it's one that we really need to continue to focus on resilience and well-being issues concerning not only just pharmacy personnel, but also our patients and the general system. And these issues existed before COVID. And COVID, unfortunately, was I lack of a better phrasing, I said it was the duct tape Band-Aid that got ripped off that showed the wound of wellness and the lack of wellness that we had in the healthcare professions. It's not just a pharmacy problem. And in case in point, we were actually IPHA was very fortunate to be part of an 85 organization panel, our consensus group that met in the summer of 2019 that helped develop 50 recommendations for the profession on well-being and resilience, and how we look at that from a data level to student pharmacists, to technicians, to employers, looking at everything that impacts it, including payment reform issues and how those have created the ultimate stressors on the profession. And I think that we got to continue to look at policies. I mean, Illinois was one of the first states to legislate what I would call common sense things. The fact that we actually had to legislate that a pharmacist deserves a lunch and a break is silly, that we actually had to get to that point. But sometimes you have to put common sense in the law, and that's what we had to do. And we're continuing to look at that too. We're kind of continuing to look at other ways of being able to protect pharmacists and to try to help elevate their voices. We're looking at doing a workforce survey right now throughout the whole state to get more information where people feel comfortable about reporting that information, because there's a lot of things that happen in the workplace that people are afraid to talk about. And I understand that, but we also have ways that people can express that. And that's one way is through the Power Portal, Pharmacy Workplace and Wellbeing Reporting Portal, that's monitored by APHA and NASPA, the National Alliance of State Pharmacy Associations. And that Power Portal was started whenever I was in my presidential terms at NASPA. And I think it was whenever I was immediate past president. I think that's when that came on board. But it was very essential because we're utilizing an existing federally qualified patient safety organization. Now, patient safety organization may be a term that you may or may not be familiar with, but it's usually used for evaluating medication error data. And it does by looking at the same data and helping report it. But what's great about it is it's confidential and it can't be subpoenaed. So we decided to use that same model to allow for pharmacists, technicians, and students to be able to report about their workplace. And it's 100% anonymous. No company can come after it, even if they want to. And you are free to report about what's going on, both good and bad, because we want good examples as much as we want the worst examples. And what that data showed us is it showed us that violence and harassment is unfortunately up, which is something that we already knew about. But one of the aspects that is coming out of that data that we didn't think was as high was violence and harassment coming from our patients. And that's something that we've never had to deal with before. And that's why APHA now has a policy and a program focused on zero tolerance of these type of behaviors. But it's something that whenever I was fortunate enough to present with my colleagues from Wisconsin and Indiana at one of our district board of pharmacy meetings a couple of years ago. One of the things I pointed out with that data was now that we're seeing this violence and harassment coming from our patients and a statistically significant concern, how do we handle this from the board of pharmacies? Because the boards of pharmacies are constructed to protect the public from the profession. But what do we do when the profession is now the danger? I mean, when the public is now the danger. Correct that. So how do we look at that now, when the public is now the danger to the profession? Sorry for that very, very, very long answer to your question.
No, you're good. We have now better understanding how it's working currently and how we could change in the future. So that's all we have for today. And we really appreciate you coming and answering our question.
Thank you for sharing with us today.
Thank you, Dr. Reynolds, for coming in today and talking to us about advocacy and pharmacy by sharing your experiences and insights with us. Your perspectives on advocacy and pharmacy has given us a deeper understanding. Thank you once again for your time with us today.
Thank you, students, for hosting the podcast today, and thank you, listeners, for joining us. Please share this episode with your friends and on your social media outlets, and seek out the other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcasting channel.